Hello, I'm Dr. Basil Considine. I'm here from the ACU Online Writing Center, and today we're going to be talking about something that comes up a lot in a number of fields, which is to say, how to write a case analysis report. So today we're going to be taking a little bit more informal a look than normal at an assignment that comes from our PCM class 622. This is the Applied Next Generation Sequencing Analysis class. Now, this is a class that comes as, I would say, a more advanced point where people often know a lot about their topic. And one of the questions that comes up is, how much information should you include? And here, the best guide is always to look at the target length. Now, if you are looking at an academic journal, you can flip through the virtual or physical pages and get a sense for roughly how many pages or words they are publishing, but most journals will also give you a target word count or word count range. And so just like so with this assignment, if we look at it, we see leaping out at us here that this assignment should be 500 to 750 words. And the next question that follows logically is, well, roughly how many pages is that? Well, if you're using our APA course paper template, which has 1-inch margins on all sides, which has double spacing and a 12-point Times New Roman font, that's going to be right around 2 full to 3 full pages. There's a little wiggle room because sometimes you have longer words and sometimes shorter, but at this level of writing, it's going to be roughly 2 full to 3 full pages. So that is both enough length to go into some detail, and also so much that there will inevitably be things that you know about, that think about, but you're going to leave out because you want to keep this very focused on what you're trying to do. Now, we have here both the instructions here. Let's take a look at those. Please review the case reports and research what types of therapies are available based on the variants detected. Your references should come from any week's required material and from peer-reviewed articles which you research. And then this should be submitted using a Word document, using our template so that it's formatted correctly, and you'll have a reference page that shouldn't count towards the word count. And because this is following APA guidelines, you also have a cover page. So cover page, references page, and in between them, 2 to 3 full pages worth of paper of the assignment that you're going to be writing. And if we look at the rubric, it's mostly repeating things that we know already. It's saying you must, to get full credit, reference the readings and resources, and you need to do an integrated, thoughtful response. So that it is going to be more than just summarizing. You should also be discussing the information and talking about how this is suitable, perhaps discussing the advantages of one therapy versus another, and do all the things that in precision medicine you want to be paying close attention to. It's not just using any available tool or any tool that has been used in the past, but trying to select the best one for this particular patient and their needs. And so when it says arguments are supported with references to learning material, that instruction is saying, oh, yeah, you shouldn't just be making claims or statements about what to do. Those should be clearly backed up with citations supporting your argument. And we can talk about that a little bit more later. All parts of the assignment, that is a good thing to have repeated, that these are not suggestions for what to do, these are requirements for what should be in the paper. So we want to make sure we're doing all the things that are listed here. And then written using clear, concise statements. So this is one of the reasons why there is that page limit or word limit of 2 to 3 pages effective total. We want to be clear and not distracting. So focus on the details at hand, say things in a concise manner, meaning less wordy, which allows us to be very precise and not be poetic. We want to identify exactly what you're talking about, which generally is fewer words than if you're talking indirectly about it. And then, of course, APA citations, formatting, perhaps headings, and that specific use of a reference page. But you can see that most of the points here, 12 out of those 14, is going towards, have you done the things the assignment is doing, and it's clear that you have analyzed the sources you're using. So not just summarizing them, but that you are identifying the key details, in some cases identifying strengths and weaknesses, and making a synthesizing recommendation. Synthesis is when you take the information and say, okay, so what? What should we do? What does this mean? So you might have a patient who has a certain genetic variant, and you say, okay, so normally this is the therapy recommended for that. But for patients with this other thing is recommended, so we should do this instead, even though the normal best practice is to do X. And that should all be backed up with citations to the reading. Now you have the option, as laid out here, of using prior reading, and this is coming from the week 6 of the course, so anything week 1 to 6 that you've come across so far, or you could do additional research. All right, let's take a look at that particular set of case studies here. And so we have case 1, case 2, case 3. So looking at this, you should be budgeting roughly 1 page per case. And so that gives us an idea about how this should be organized. So let's talk about how that organization would take place. And for this, we should go ahead and grab a copy of our APA course paper template. Now, I've gone to the ACU Online Writing Center website, which is blogs.acu.edu/online-writing-center. And if we go to resources and look under APA 7, because we use APA 7th edition at ACU, especially in all the online programs, we have this APA course paper template that you can click to download. Now what you want to do is click this download button. Now if this is your first time using the template, you'll see that we have all these little instructions about how to use it, things you might fill in, and if you've used it before, you're probably going to do what you see me doing right now, which is I'm going to review, and then under delete, I'm selecting this drop down and deleting all the comments in the document. Now for shorter assignments, and this is one of those, you usually don't have to do an abstract, so we'll just delete this as well. And then you can take all this placeholder information to show how the formatting works and delete that. Same thing with these placeholder reference examples. All right, now looking at our instructions here for the assignment, we have for us 3 case studies. So whatever else is going in, you're going to have 3 case studies to discuss. So the logical thing to do is to separate those into different headings. So it's very clear you're done with this, you've moved on to discussing another one. And so we're going to go ahead and use our headings to help us. And this helps avoid having to write sentences to say, and we'll now turn to case 1. And if you have a heading that says case 1, it's clear you've moved to case 1. So I can use these built-in styles here to add an APA level 1 heading, because it's the first level of heading in the document. And we have that set up now. Now, what else should be in here? Well, let's go take a look at the assignment instructions again. And you'll see that it says, we should review the case report, research what types of therapies are available based on the variants detected, and then we should be reporting that. And along with reporting that, we need to show that we have an integrated, thoughtful response. It's going to be more than just a summary. Now, let's just take a look at some of those case studies here. Now, these happen to involve, we have non-small cell lung cancer, we have adenocarcinoma, and we've got these particular variants here. So something that you'll definitely want to be doing is reporting on the variants that are detected, and then the therapies that are associated with that, and perhaps also by exclusion, because combination therapy is very common in cancer. So we have some notes here for a case study that are giving us other things in the essay, and this is other requirements for the essay. And this is something that you should be paying attention to these and not just doing what is laid out here. There's additional information found here to follow. So in the write-up, all right, we're going to be talking about biopsy 1 and biopsy number 2. And so if we look at this, we have biopsy number 3. So there's going to be at least 3 parts here talking about the treatments that are appropriate at each stage. And in case number 2, we also biopsy number 1. So just that one biopsy. And then we have this question of what would you alter? And then case number 3, we have just one biopsy. So there's going to be some differences in the write-up of each case study because of what is involved. And, considerations when you're looking at, okay, how would you alter this if the patient was 25 years old? That has a huge range in terms of quality of life, things that people may want to do, the aggressiveness of the therapy. And depending on the history, how long they've been fighting it, patients may elect for different things, especially since, this is a case where we have a cancer that is metastasized. So what's going to go in each of these 3? Well, we're going to have a clear identification of what the initial case. So no matter what your recommendations are going to be, you have to discuss each biopsy in turn. And now we can go back to the assignment instructions and see what other questions have to be answered. And so to give yourself a guide for what to do at each stage, you can copy and paste the instructions from that case write-up and put them in here as reminders. And even before you do your research, you can start crafting language that is appropriate for this, such as, I'm just going to change our stylization back to regular. Okay. Now, depending on what you know when and how things change, there's going to be more detailed discussion, but it's always going to be coming back to based on what we know about the patient right now. Now, if we take a look at some of the reading that goes with the class, we'll find some examples, but you can also do some research on your own. So let's say we're talking about this. Now, DNMT3A, if one has the misfortune for lung cancer, there's some significance to that. Now, whether you're searching in Google Scholar, whether you're using the library catalog directly, and you can integrate these, by the way, the important thing is to be doing a search for recent literature because we want to use the full means of what is available. Now, when you are searching, you don't want to just search for a particular mutation, but we also want to search for a mutation that is appropriate to the case. So here we are talking about non-small cell lung cancer, okay? So if we search specifically for this, we still got a lot. We got 4,000. But let's look at least the last 4 years to try and get more relevant. And we see, oh, there are different therapies. Now, I don't know which ones you will recommend. I don't know which ones you'll focus on. But this is a way to get a quick idea of some of the more emerging findings this. And you'll have to, when you're looking at this, determine is this something that you can, in good conscience, recommend. Just as a doctor working with the patient needs to make sure that they are balancing the patient's wishes with the advantages and disadvantages of any drug, but particularly something like chemotherapy or monoclonal antibodies that may have significant implications for quality of life. So, some of these are more advanced research. Some of these are about active therapies. Some of them are about best practices, and there are various resources that you might want to make sure that you're using. Now, another way that people will sometimes search for something like this is to look at targeted journals. And you can see I just searched for Cancer Therapies Journal here, and you'll see that there are some that are focused on very particular aspects here. And there are some that are, like the Journal of Cancer Therapy, that are very specifically targeted towards giving you the latest, most up-to-date things, or something like Cancer Research and Treatment, say, It's designed for a practitioner to be able to track the latest findings and learn about efficacy in emerging drugs and things like that, rather than having to read many, many different journals. So you might go searching in some of these or be looking for their names to pop up when you are doing a journal search. Now, if we were to do a search for cancer therapies, DNMT3A and SCLC, you'll probably have the information overload thing because, while there are some interesting implications of this nanotech therapy, unless you're at a particular type of research institution, you're less likely to have access to that. It may be something that's working in a lab but has not yet been done in vivo. So let's do some limitations. First, limit to full text, because we want to have things that you can read. Also, limit it to scholarly peer-reviewed journal articles. And let's also add a date restriction, because we want to be looking at things that are reasonably current, and there are lots of things that can change quickly in cancer therapy. So starting with the last 5 years as a rough definition of recent, we can now look through this and see, okay, an article about a key therapeutic target, if it's about the therapies that are being evaluated to target that thing, that might be of interest to you. But a more general thing about the mechanisms, perhaps less so for this assignment, because we're looking at recommendations for the patient that you can do now. And so as you go through this, you want to be careful about screening things so that you are working with therapies that are available right now. Now, in this particular course, it happens that there was an assignment the previous week on variants. And so if we look at the readings and resources and you have something that is of value, of relevance to this assignment, then you might look at this and say, okay, I want to copy one of these. And these are, for the most part, formatted in APA style to the point where you can copy and paste this into your references list. So for the sake of illustrating, let's say you were going to do that with these sources. So I've highlighted them, I'm going to copy and paste, and then I'm going to go to the references section and paste them in. Job done, right? Well, not quite yet, because none of these are currently fully in APA style. There are a couple things we need to do. First of all, they're formatted as bullets, they're in a different font, so we'll use the APA reference style here. And then we want to go through, and you see these download links. We want to remove that because that's something from the website that we do not want to have here. So a couple ways you can do that. Here, if you type into this or select it and press Control-K on a Windows computer, Command-K with a Mac, you can remove that link. And then for this bright blue text, we're going to remove this download text, which is another copy of the link. So that being there is what we call an artifact of the copy and paste process. And so we'll also click on APA reference again with these selected to overwrite that font with the correct one for this style. And then there's just a minor typo there, so we can fix that right now. And we'll do the same thing with these other ones here. So again, going to go ahead and remove that link. Take this whole thing and apply the APA reference style again, and then we can go ahead and delete this download link here. Now, one thing that you might not know is that there's an APA style rule that says if the title of a journal starts with the journal, you leave out the word the. So we'll take that out here. Go ahead and remove this here. And then we will set that to the right font. And again, we'll remove the links. And change that to the right font. So if we look through this, looks pretty good, except our references are not in the right order. We need to have these alphabetized by first author's last name. So Landrum will go at the start of our list. Ta-da. So you can see that all of that took us a matter of a minute or two to get this done. So not a lot of time. We want to look to find something like that where, oh, there's just a minor typo there with the capitalization. And so we look it over and say, okay, this looks good. We have our references. Remember that in APA style, you need to cite all the sources that you reference and vice versa, barring a couple things like interviews and archives. If it's a publication, this should always be cited if it's referenced and referenced if it's cited. And something for those of you who may have been out of school for a while, if you have a source with 3 or more authors, the first time you cite it, you just automatically go to first author et al. So that would look, this was published in 2013. So if you're citing that one, you would have Rem et al. 2013 for our citation there. So let's do a quick recap of what we've looked at today. We started with approaching this case study write-up, looking at an assignment coming from the Precision Medicine program. We looked specifically at this week 6 assignment here that requires you to review case reports and write up recommendations based on different events, like biopsy data coming back. And we looked at how to check the rubric for what is supposed to be done. Okay, so most of it is what we would expect from an APA-style assignment. We need to cite where the information is coming from. We should be concise, clear, and precise. And when we looked at the instructions here, we found that there were 3 cases, and so that means we should have a different section for each, and that each of these is going to have some particular events or questions that you should be writing up as you are describing this. So an easy way to keep track of this is to paste this information into the body of the template that you're working in so that you are able to look at all that information together and be reminded of everything you have to do and the order that you should be writing it up. So this essentially focuses on 2 parts. And so let's look briefly at case 2 here. And you want to start, and it's giving you a very clear image here, that there's breast carcinoma, that it's metastatic, NOS, and that the tumor we're looking specifically at is in the breast. And so based on this thing, we'll describe our patient. And we can see, all right, you're going to be doing something at where you're going to be is giving the best recommendation, whatever that is, and telling us your basis for that, including citations, and that we also want to make sure we cover if this patient were 25 years old, would you give the same? Would you give different? Would you be cautious and would you present it to the patient for a choice? Whatever it is, you want to mention there. Now, keeping in mind that this particular one has a lot of variance here, which is one of those things that's more likely to be found when cancer has metastasized, you may be giving different advice based on what you think the prospectus for this patient is and the quality of life associated with these different treatments. So, operability, the variations, the therapies that target specific variants and whatever they've exposed or made more vulnerable, well, those are all things to consider. But just keep in mind, we do have only 500 to 750 words here, so when you are planning this out, you want to make sure you're doing exactly what is required first. because if you start putting in information that is not required, just looking at these notes we have here for the outlining, that by itself is 91 words. So once you've done all these things, once you've reported on each biopsy and how that influences the treatment, you're going to be pretty close to that target already. So do the things you have first and then move on. Now, if you have any other questions, you are more than welcome to write us at onlinewritingcenter.acu.edu, to go to my.acu.edu under the resources, select the Online Writing Center and follow the instructions from there to schedule an appointment, or go right to the Online Writing Center website. This has been a presentation from the Online Writing Center. I'm Dr. Basil Considine, and that's the end.